public hospitals have started restricting visits to patients. Most say that they are limiting the number of visitors to 1 or 2 per patient for now. At Singapore General Hospital, they are barring children under 12 from visiting its ward patients. Razor TV was at Tan Tock Seng Hospital, where many possible swine flu cases are brought to.
This separate wing of Tan Tock Seng Hospital is part of the war against swine flu cases. Cases from the airport and patients who have travelled to affected countries are scanned here. And when Razor TV visited the place on Wednesday evening, we witnessed one patient being whisked off to the Communicable Disease Centre for testing. Patient 18 or more. But the testing procedure is part of the battle against swine flu here in Singapore.
I think we did well last time, but there was an old war. This is a new war now, and we have to adapt our approach to face this new enemy. And in many ways, this new enemy is much more difficult than SARS. I would stress 3 points on why it is different and more challenging to deal with. I think first, this swine flu is a lot more contagious. You look at how fast it has spread around the world to several countries now, and the speed of spread. And secondly, as you heard from the earlier technical briefing, that unlike SARS, patients can be infectious even before symptoms appear. So what this means is that border control cannot be foolproof. And I think third complication of the flu pandemic is that historically it tends to come in waves. So remember SARS, we had a big fright, and we won the battle, and it just quietly faded away. Whereas flu pandemic, unfortunately, has a habit of coming in waves, and sometimes the initial waves may look mild, so your guts are down, and then the second wave can then be quite lethal. So this third difference means that dealing with this swine flu pandemic is likely to be long drawn.
Alert yellow level precautions are in place at Tan Tock Seng Hospital to prepare for whatever wave of cases that might come, and that means temperature checks and surgical masks for visitors. The latest precaution, thermal scanners, which started operating at 8 p.m. on Wednesday night. This will help the busy hospital keep tabs on about 10,000 people which head to its wards and medical centres every day. So if you have an appointment at the hospital, better head there at least half an hour earlier, especially on Mondays, Wednesdays and Fridays when the facility is a lot more crowded.